Hi everyone. First, let me apologize for any background noises you may hear. We have 40-mile-an-hour winds right now, and so things are a little hairy around here. Here is my presentation for research methods for schizophrenia. The main question we will be trying to answer is, will this new medication be as effective as the original medication to treat schizophrenia in adults? Let us answer the question, would experimental research or non-experimental research work best for this study? With non-experimental research, researchers have very little control over the research, and they mainly have to rely on observations and interpretations. Obviously, this is not as accurate as we need for this type of study. However, with experimental research, it is usually performed in a control environment, and the researcher has control over most of the variables and subjects. It is also the most accurate research method to use. What we propose to do to determine whether the original drug to treat schizophrenia works better or worse than the new drug for treatment is to describe the differences between the two study medications and the effects they have on schizophrenia. What we will be using is the true experimental research design, because our researchers need to have control of the study and medication, because we need the most accurate results as we can get, and because we will need to be able to select the participants from a group of people who meet the requirements of the study. What we propose to do is gather 150 participants for this study, who must be diagnosed with schizophrenia, on medication to treat the schizophrenia, and be at least 18 years old. We will find the participants by advertising the study in mental health facilities in the area and by talking to different psychiatrists in the area, who may be able to suggest to their patients that they take part of the study. Due to HIPAA, we cannot ask the psychiatrist for patient information. The patients must come to us. We will split the 150 participants into 3 groups by random selection. One group will get the new medication, one group will get the original medication, and one group will receive a placebo. The medications will be given out weekly to the participants. We will let the participants know that it is very important to take the medication at the same time every day, and we will have daily check-ins over the phone just to make sure that the patients are following our requirements. We will collect data every week when the participants come in to get the medication by having them answer questions about their symptoms, psychotic episodes, and how they feel in general. We will also be looking at their body language for signs of psychosis or untruthfulness. We will perform this research study for 3 months to ensure that we get accurate results. We will also, when we are analyzing, use the paired t-tests because it is the best statistical test to do for 2 related variables. Once analyzed, we should know if the original medication works better or worse or just the same as the new medication, and whether the side effects are better or worse or the same. Proposal, and if we are chosen to perform this study, we will make sure it is conducted ethically and cause no harm to anyone participating. Thank you.